Hey everybody, my name is Dr. Cade, and we are back again with Dr. Duane. And this episode, we're going to be talking a little bit about dizziness and vertigo. So, I've been open for 10 years here in Naples, Florida at LIFEstrength Health Center, and again, we are experts at family wellness. But when symptoms start to get a little funky here, we've been able to help people, but you are at a completely different level, diving in deep, trying to figure out exactly what's going on with the brain, where it's coming from, how long it's been there, what people need to do.
Yep.
So let's just start from the top, Doc.
Yep.
What is functional neurology?
So functional neurology is something I use to help patients with like the dizziness and vertigo there. It's basically going through a comprehensive exam of the brain, the function of it, the coordination from top to bottom there. And it might be visual, it might be sensory motor, it depends. It's different for every patient there. And when you're talking about the vertigo and the dizziness there, it's always more of a sensory type thing. Is what is the patient getting from outside where, you know, their brain is telling them, hey, this is what you're sensing. And a lot of times patients will say, hey, I feel like the room is spinning, when really they know and we know that the room isn't spinning, but the brain is telling them that. So functional neurology is going in and figuring out what's working properly, what isn't working properly. How do we stimulate that or calm that down? And that can be done by specific brain exercises. We can use diet, nutrition, or we can limit environmental factors. Maybe it's a toxin, maybe it's something that they're coming in contact with or getting overstimulated by.
Okay, so again, the brain is what's, interpreting our surroundings and adapting to daily life. So there can be an issue with how the brain's interpreting the outside, and also how the brain's communicating to the rest of the body to interact with that environment as well. So you're digging in deep and trying to figure out what the root cause of that person's troubles or symptoms or issues are.
Yep,
correct?
Exactly.
Okay, that makes sense. Next one is how can you really help balance issues? Can you really help vertigo? Can you really help dizziness?
Yeah, and so patients usually downplay that, right? Where they come in and they maybe in their 40s or 50s are like, doc, my balance isn't as good, and I'm just getting old. I'm just getting old, and I love that because we'll go through an exam and we'll go through some just simple things like the gait or the balance in a single leg stand, and they just laugh. They go, before they even do it, their body knows that they're not going to be able to stand on that right side. They've struggled with it, and then they tend to see more pain or more discomfort, more symptoms on that side, and that can lead to a dysfunction or dysfunctional signal going up to the brain and telling them, hey, where are you in space? If you don't know where you are in space, you're not going to feel very stable. The ground's going to feel like it's moving. You're not going to feel like you're where you are, and that's where that dizziness and that vertigo come into play there. So, I think the primary thing is not just about can we help it, it's more can we figure out where is it coming from, and then that always makes treatment or helping people 10 times easier.
So do you see when somebody develops that dysfunctional pattern and then they start going through it more and more and more, do you see that makes it harder for you to reverse that, or is it easier for you to identify and then be able to treat it?
Definitely, because the brain develops plasticity. When we say if we get injured, say if it's a car accident, a slip and a fall, you hit your head, whatever it might be, if it's a sudden onset like that, and we don't go and rehab that area of the brain or whatever was injured there, that rehab that function of the brain, that can stay longer. Your brain can develop plasticity or a compensation where you would tend to do different things, or there would be different patterns as far as with the gait, as far as with vision, where you might notice visual disturbances where it's harder to read, it's harder to focus, it's harder to concentrate.
Okay, that helps clear things up. So what is vertigo? Are there different types of it?
Yep. And vertigo is kind of like a catch-all, right? It's kind of like fibromyalgia. If I got pain everywhere, you must have fibromyalgia. Let's not figure out what's causing it or what's causing the symptoms, but sorry. Off topic there, but either way,
Perfect analogy, though, and we get that.
I know exactly, but balance or vertigo is just more. I feel off balance. Any kind of a feeling where you're not stable, where you're not in control of your body or your surroundings, or you're very unaware of your surroundings. Where you might hit your knee on something and you're like, I always hurt the right side of my body. Well, if you're not very aware, if the sensation's not coming up to, say, the right side of the body is controlled by left side of the brain, well, that same sensation goes up there and communicates with that. So that's where vertigo comes into play, and when that stuff isn't taken care of, it perpetuates and it makes a host more issues there.
So what are the types of vertigo that you see when you're diagnosing, when you're figuring out what the root cause of it is? What are the ones that you see most common in practice here?
typically patients will come in and say, Doc, I got vertigo. I went into the urgent care and they gave me a couple of somersaults, they like to call them, or they told me to go roll on the bed. Well, that's usually going to be what's called BPPV, benign positional proximal vertigo. It's a big word, but really what it is, it's the inner ears, the crystals that are inside of what are called our semicircular canals. Those little crystals have actually slipped into one of those. And every time you go to move your head or do a movement of your body or your head, that fluid is stimulated by those little crystals, and our eyes try and keep up with that movement. Because when we turn our head, our eyes are supposed to move with that. Those movements are yoked together. When those don't work very well, that's where we get signals of, hey, the entire room's spinning because your eyes are trying to keep up with that.
Yeah, it's hard to see somebody going through that. So
Yeah,
BPPV,
Yep.
we can say that 5 times fast.
Yep.
Any other ones that you commonly see in practice?
Common, especially in a chiropractic clinic, a lot of people coming in with neck pain, just a cervical vertigo or cervical genic vertigo is where we're getting diminished or dysfunctional signals being sent from the joints in the neck and the muscles to that opposite area of the brain, where if, like I said, when our eyes are very closely intertwined with our inner ears and our neck muscles, everything has to work in concert there.
Yep.
When that doesn't happen, all those little tiny what are called mechanoreceptors that are shooting input up to their, they're getting different signals, and then that's where the patient is going to feel like, I just don't feel stable. I don't feel balanced. So that's one of them.
And again, in the age of the digital world,
Yep.
with everybody having down
It's very straining on the neck for sure.
and probably a pretty common thing that you're seeing these days, right?
Yep. We've also had a couple of patients that have also had Meniere's disease, and that's a common one out there too, where that's something that it's uncurable, but there are things that you can help when you diagnose it properly, which side it is. Most patients already know where it is. They get some pretty bad pressure in the ear, then all of a sudden it's decreased, they lose balance, and then they're good again. Maybe they get sick, maybe they get ringing in the ears at the same time. But looking at their diet, their nutrition, looking at neural rehab exercises from the plasticity, your brain will develop different plasticity and movement patterns with the eyes, with the vestibular system, with your body, and you'll see on those people they're crashing on that side where they got the Meniere's most affected them.
Well, that Meniere's is just a devastating diagnosis, and we've had a handful of patients with that over the years, and it's just it really robs somebody of the joy
Yep.
of life. But you keep hearing Dr. Duane say plasticity, and I think it's really important to note that just like your brain can go through survival instincts of rewiring or creating detours of the pathways neurologically, we can also retrain it and rewire it, if you will, to do the opposite and relearn normal, not dysfunctional behavior, right? So we've got BPPV, we've got Meniere's, we've got cervicogenic. Are there any other types of vertigo that people might be experiencing that you're trying to find?
Yeah, and I don't know why I didn't say one of this earlier, migraines. Migraines are huge, and anytime you're getting mixed signals or if you're getting overstimulated by your environment, whether it's visually, most of the time it is visually. Think most of us are on a computer, and when we're not on a computer, what are we doing? We're sitting on an iPad, on our iPhones, and we're constantly tracking, and we're really overworking our eyes these days. So that is so difficult on that. And then when we overwork an area of the brain, it's usually unilateral, and or on one side there where people get in a temple, and it's just like, Doc, I feel like I got a stick right here in my head. So we need to examine what area isn't working properly. How can we rehab that? How can we get that threshold back up to where we need to be? Where down here it doesn't take that much for that patient to get a migraine. Most of us, it takes a lot of stimulation for us, a lot, like it's like a movie, or we've been at work all day long and we're stressed, and then finally, boom, then I'll get a headache. But most people are down here where it doesn't take too much, where it could be a head turn, it could be riding in the car with their spouse.
It's heartbreaking seeing somebody go through that. So again, we've got the labels, we've got the diagnoses, we've got the ability to figure out which one of those it is, and clearly you're alluding to some of the treatments and the rehab that you're able to do to help decrease the frequency, decrease the severity, and improve somebody's tolerance. Tell us about some of those treatment methods that you're using.
Yeah, I mean, first and foremost, we are chiropractors here, and we love working with the nervous system and the spine. So we're going to adjust if it is necessary. If it's too much stimulation, like I'm talking about thresholds here, you get to see my little hand here, this is a threshold. If a normal threshold is up here and you're down here and I do an adjustment, that might put you over threshold to where we get symptoms. So we want to be sure that we're doing it safely. So sometimes we don't adjust patients. We're not to that point where we may have to go and do different visual therapy, different neck therapy, things that help reintegrate the brain. And then we can get into that, very specific adjustments. And then we want to talk about diet and nutrition. Sometimes that's almost more important than doing any of the adjustments, doing anything else, because if we're not getting proper fuel to the brain from the gut, then we don't have enough oomph to get the job done. We don't have enough fuel to go and do work or anything. So a manipulation might actually kind of overdo that. So we just have to figure out where are you on that spectrum, and then how can we support the brain function, and where are we going to come at it first? Diet, nutrition, or exercises?
Yeah, and that's one of the hardest things. There's an art to all of this, and Dr. Duane, as a practitioner working with so many patients, knows that how much is too much, how much is going to send a patient backwards. If we do too little, that patient also isn't going to be happy. So there is a very fine line in helping someone not just feel better, but of course to help their brain function better and their neurologic system function better. So funny thing, one of the first things that Dr. Duane asked for when he came into our clinic, we invited him in, he asked for a set of headphones, and I thought, what is this guy doing, in a chiropractic, in a health center office? But he is so outside the box thinking. So tell him a little bit about the sound therapy that you're doing. You're also doing some things with colors. You're doing some things with scrolling images and things like that. So tell him a little bit about that.
Yeah, well, say we have a patient right now with Meniere's, and she actually had loss of hearing in the left ear. That's where the pressure was. She also had a decreased vestibular function on that side as well, just due to that Meniere's. And I'm always educating patients. I always bring a brain out. I like to show them what areas are or aren't working. So once we decipher what area isn't working, then we want to go and try and stimulate that. So for that in particular patient, which we'll be going into another testimonial video with her in the future, so look out for that one. But just by doing that first initial exam, we found diminished function, especially on the opposite part of the brain where it's higher level thinking and organizational tasks. And you could see in the patient that they were kind of flatlined. Their personality was lower. They weren't feeling their self. They couldn't do, they used to work on 5 computers at once. Now they could barely work on 1 computer at once without getting, symptoms of dizziness or whatever it might be, or headaches. And they just didn't feel like themselves. So when we find those areas that aren't working properly, we have to figure out how to stimulate them and how to kind of stimulate them all together. So we would be doing a little bit of sound therapy in the left ear to stimulate that. We were doing what are called optical kinetic movements here, which is just basically having the eyes pursue and saccade or jump back to a target and do that smoothly. And we also had her doing some coordinated activities on the left side that were stimulating the right part of the brain as well. And by tying all those together, literally on the, was it first or second visit, where she goes, Doc, I can hear that. Where it was even surprising to me. And I will not lie to you, I was even a little bit surprised that day too. We're trying to stimulate areas, and we're trying to stimulate that part to get hearing back, and so she got some tones back. It was the higher level of tones. She didn't get all her tones back lower, but that right ear had taken over. That plasticity that we talked about had taken over all the hearing. Yep, and that left ear had just basically shut off. She was getting input into there, but the brain was not receiving it.
That was an emotional time for all of us. Dr. Duane came out and grabbed me, and it's a patient that we love and adore. And again, we'll be doing a bit of a case study, I think, on that, or a testimonial on that, talking about it. But as you can tell, Dr. Duane has a wide array of measures here to help people, and it's a very individual treatment. No one person is dealing with the same issues in the brain, and so no treatment can be the same for the brain. So we love all of you, of course, and we want to, again, get down to the root cause of why you're dealing with what you're dealing with, and we'll let you fill in the blank, whatever it is that you're dealing with, but it's our heart to help you develop a treatment plan that's individual for you. And again, it's so important to not push too hard, not push too little, but just right, and that comes from a great relationship with our patients and the knowledge and the wisdom that you have. So is there anything else you want to say before we sign off on this one?
I feel bad because I've been talking all about myself here, but we have such a great team here where if we feel like it's a functional medicine deal where we have to do more lab work and lab tests, that's another thing I didn't mention, that we have Dr. Carolyn here. Sorry, Doctor. And we also have her to do extensive testing, and we have Dr. Cader, who's a spinal specialist. So if I feel like it's a curvature deal that could be causing that neurological dysfunction there, then we're going to try and work with whoever is the best provider here, and maybe you get a little bit of me, a little bit of Dr. Cade, a little bit of Dr. Carolyn, but we're just here for the patient's best interest.
That's what it's all about. We're a team of doctors who care. So thanks for joining us, you guys. We hope that you are healthy, happy, and safe. And until the next one, I'm Dr. Cade.
Dr. Duane. Take care.